Hey everybody, welcome to the Wellman's podcast. I'm really excited about our guest today. I'm really excited about all of you listening out there today too. Thank you for wanting to know more today than you did yesterday. And today we have two guests on that we've had on before that always excite me and teach Brian and I and our guests a lot. So I'm going to reintroduce them. I'm also going to point out after I introduce them, how, the other episodes they've been on. And I would recommend go check them out on some of the other episodes on the Wellman's podcast. But our first guest here, I'd like to reintroduce Dr. Joe Cleaver. He's a fellow of the American Board of Anti-Aging Regenerative Medicine. In addition, he's board certified in internal medicine. He's also board certified in anti-aging regenerative medicine and has achieved certification in advanced metabolic endocrinology, specializing in bioidentical hormone therapy. As a faculty member at A4M, the American Academy of Anti-Aging Medicine, and MMI, Metabolic Medical Institute, he lectures both nationally and internationally in longevity medicine, sports performance, and regenerative medicine. Board certified in internal medicine and a rheumatologist, he is an expert in medical orthobiologic treatment of sports injuries and disorders of the musculoskeletal system. He holds the position of adjunct clinical professor at George Washington School of Medicine, where he has taught the exercise prescription component of the master's program in integrative medicine. He is a past member of the Scientific Advisory Board and Board of Directors for the International Peptide Society. Dr. Cleaver lectures on the use of peptides in longevity, senolytic science, aesthetics, and hair restoration, and actively trains medical professionals at Peptide Practices of America. He has authored and published research and textbook chapters while at the Cooper Institute and Cooper Clinic. He has conducted NIH research funded by Homeland Security grants, assessing the health and developing fitness programs for first responders, focusing on first responders. He has written numerous articles for several international sports and anti-aging magazines. He has co-authored the exercise and muscle health chapters for the George Washington Medical School Integrative Medicine textbook. He is a master trainer at Train Now MD, a highly sought after hands-on training program in the field of regenerative and cosmetic medicine. As a PRP, platelet-rich plasma, PRF, platelet-rich fibrin, and decellularized growth factors expert with 15 years experience in regenerative aesthetics, he's applied this cutting-edge regenerative medicine science in the treatment of hair and restoration, minimally invasive aesthetics, skin and face rejuvenation. In addition, he is a master trainer in plasma pen and PDO, Reds Aesthetics, body contouring, and developing plasma pen. Currently, he sees patients at his Paradigm Wellness Medical Group, LLC offices based in Dallas and Sonoma Valley, California. Wow.
So you're a smart guy, Dr. Joe. Thank
you. I'm thrilled to have you on.
Yeah. You didn't get the abbreviated version.
I know. Actually, I love it because I want our listeners to know. But yes, we're thrilled to have you on. So thanks for being on.
Thank you.
I'm also very thrilled to introduce Mary Ann Coffey, a pharmacist and certified clinical nutritionist, and also board certified in the American Academy Anti-Aging and Regenerative Medicine. I've had the wonderful opportunity of working with Mary for the last 2 years out of my clinic. She sees patients online, sees patients all over the world. She is a member of the American Society of Consultant Pharmacists and board member of the North Carolina Integrative Medical Society. She provides guidance, support, and solutions relating to pharmacogenetics, drug-induced nutritional deficiency, medication, therapeutic management, weight loss, anti-aging, boosting immunity, and chronic inflammatory response syndrome. Her programs ultimately educate her patients and empower them to make changes that lead to long-term improvement, which I've seen firsthand at my clinic. Mary has worked in pharmacy for 17 years prior to starting her company, Boutique Wellness, and noticed a trend that more and more medications are being introduced to the market that were diminishing the quality of life for her patients and people. She set out to establish a place where people can turn to have someone develop a personalized plan for them and their goals. As an educated practitioner who sees power in providing personalized medicine, Mary is passionate about her line of work because there's nothing more rewarding to her than seeing her patients transform. I've had firsthand evidence of that with my patients who absolutely adore you, Mary. So thank you for being on. I just want briefly, before I give you guys another thanks, I just want to let people know about the episodes that you've been on the Wellman's podcast. So Mary, you've been on 2 episodes with us so far. You're on back episode 27, drug-induced nutrient deficiencies, and then episode 60, when we were talking about fasting and the ketogenic diet. 2 wonderful episodes that we've had a lot of hits on. And Dr. Joe, we were thrilled to learn about peptides, and we had that on episode 108 through the Wellman's podcast. So you guys out there, go listen to those. They're fascinating, stimulating, intellectually stimulating, and also you guys will be in wow and awe like both Brian and I are. But anyway, thanks for both of you being on today.
Well, thank you. Those are very kind words. We appreciate them immensely. Thank you.
Thank you.
It's a pleasure to be here.
Yeah, thank you so much. So currently, you know, we're going through this scourge here, the whole world and the United States. The United States seems to be taking the brunt of this coronavirus. And what's fascinating to me is that, you know, we hear about all the social distances and the common sense stuff that we can do to kind of protect ourselves and others. But the one thing I don't really hear, but I hear it from practitioners like yourselves, but it's not so much on social media, and it's certainly not, you don't hear it on the conventional media. And it's just ways beyond the common sense stuff to kind of boost your immunity. And that's why I'm really thrilled, and I want to hit on that thing with both of you right now.
Yeah, one of the, I think, most pertinent facts that have come to light in just the recent past, and if we focus on how we can defend against the COVID-19 or any virus, if we just look at some of the recent publications on the effectiveness of successfully treating COVID-19 with high-dose vitamin C. So we can move right to nutraceuticals and boosting the immune system, even in the acute phase. So there was a study out of China not too long ago using high-dose vitamin C in the acute setting when these patients were already diagnosed, had fever, and they were giving them IV vitamin C, and actually they were cured, most of them. And we did not have to go to antivirals or other medications that are, you know, currently we don't really have a therapy for this that has been studied effectively. So we're anecdotally treating these patients. But if we look at vitamin C and the enormous amount of studies that have been done in vitamin C in reducing viral illnesses, that was just a natural go-to nutraceutical or supplement or vitamin to try and treat the virus. So now there's doctors in the United States. There's a doc in New York that looked at a similar study that's treating COVID-19, and he's given 1.5 grams of IV vitamin C every 6 hours to his patients in the hospital. Well, I just gave a webinar not too long ago to physicians, and if I springboard off of that and what I was telling physicians, that what I'm doing and what I see successful is first and foremost is prevention. Very strong immune system is our best defense against this. So one of the most important things that I'm doing is having all my patients are getting email blasts out there recommending high dose vitamin C. If you're well now, I want you to take high dose vitamin C. If you can, 4 or 5 times a day, 1 to 2 grams, 4 or 5 times a day. So we're up to 6, 8, 10 grams, and you're not treating an illness, you're not treating the virus actively. But when we see what it does in the mechanisms in the immune system, it readies those white cells that we need, macrophages and neutrophils, to be ready to attack the virus right away and do it in a very efficient manner. So
you're talking. So this is interesting because you're actually talking about not only preventing but actually treating this with vitamin C.
Correct.
Right.
Right. So people can take this and start taking vitamin C right now. You don't have to be sick to do this. Absolutely. And then the other thing that's fascinating is that this is not being discussed. I mean, you're talking about a treatment that is costs pennies. Anybody can get it.
Right.
And to me, it seems like it ought to be put out there, like take some vitamin C before you actually get sick. And if you do get sick.
We're not making any claims here that we're treating it. We're just basically boosting the immunity, right? It's
okay.
an disease.
But you are saying, like in the hospitals, Dr. Joe, you were actually saying that they're doing IV vitamin C, right?
That is correct. There are
with sick patients.
Publications in the medical journals that have shown that vitamin C in the acute setting has been effective in treating the COVID-19.
Yeah,
that's claim. That's just quoting the literature.
Right. And the other thing is, it's not going to hurt anybody, right? What's the worst thing that's going to happen with vitamin C if you take too much? Not a whole lot, except maybe have a laxative effect.
It can be just ascorbic acid. It doesn't have to be liposomal vitamin C. It could be plain ascorbic acid. It actually works just fine.
And I was just going to ask you about that. So any form of vitamin C will help, right?
Yeah.
Okay.
Mm-hmm.
Yeah.
And zinc, 30 to 60 milligrams daily is what we recommend. Vitamin A, about 10,000?
10 to 20,000 units. All the immune support vitamins that most Americans are deficient in, whether our food supply is deficient in it or we have a malabsorption and leaky gut, et cetera, et cetera. I know you've probably had many guests on talking about that. Talking about leaky gut and micronutrient deficiencies.
Right.
So,
well, yeah, like if the gut is compromised, you're going to have a hard time absorbing a lot of this stuff, right? Anyway,
right.
So that makes perfect sense. But can you guys just briefly go over the main immune boosting nutrients? You just mentioned 3: vitamin C, zinc, and vitamin A that are relevant to what may help with boosting immunity, especially with this coronavirus.
Vitamin D.
Vitamin D.
Vitamin D, 5 to 10,000. At this time, I'd probably go with 10,000 international units daily.
Okay.
A lot of clinical evidence showing that does boost the immunity. And N-acetylcysteine is great. What dose? I think 900 milligrams.
Twice a day.
Yeah, twice a day.
Mm-hmm.
Glutathione.
NAC has the ability to stimulate, as you know, generate about increased glutathione in the body 2.5 times. Mm-hmm. And glutathione, when we dig down into the immune system and what I referenced before about the white cells ready to attack the virus as it comes into the body, 2 key components to the function of those white cells: vitamin C and glutathione. And when the virus does get in the body, it consumes vitamin C at a breakneck pace. It just gobbles it up. So you consumes it quickly. So we want to be ready with a lot of vitamin C. And then if you do get the virus, I'm recommending to my patients to increase those doses of vitamin C. And I have another protocol that I'm using. I am using hydroxychloroquine, et cetera. But what I found is I'm not waiting for these. There's no time, in my opinion, to. It's very difficult to try and get a test, turn it around, and then 4 days later, that patient is 4 days into the virus or into the infection, right, and they're 4 days worse off. So right. I'm right up front. I'm certainly increasing their vitamin C, making sure their vitamin D and A, zinc is on board, and then I'm using hydroxychloroquine in my patients. The CDC just decided the other day. Dr. Birx came out and said, if you decided to use hydroxychloroquine, that's the decision between the doctor and the patient. And they've really kind of stepped off a little bit. Initially, the CDC recommendations were green light guidelines, where if you're in the hospital and you're already significantly ill in critical care, we're going to give you hydroxychloroquine. Well, the reports from most of the critical care docs said, boy, it's really not working at that point. And the reason why is, and I don't want to get really scientific in this, but when I did a deep dive in COVID-19, and what I described it and really stuck the other night when I gave this webinar was, when I took a step back, a month ago, we were saying, oh, this is a viral illness. It's going to cause some infection in the lungs. And then the worst case scenario, you might get this adult respiratory distress syndrome where you're having difficulty breathing.
Yeah.
Well, now we've learned a lot in the last few weeks where this is like a smart bomb with multi-warheads. That's what I'm calling it, because it goes into the body, goes into your throat. It starts to replicate there 2 to 3, 4 days. Then it moves into your lungs. But I think it bypasses right through the lungs and into your bloodstream. And what it's attacking is your red blood cells. And that's why people are coming in blue.
Hypoxic.
People are coming in hypoxic with low oxygen levels in their blood, and they're short of breath. And it's not correlating always with what's going on in the lungs. And what I'm seeing, when I did some research, and there was just a publication about a week ago out of China, it said, we've noticed that the COVID-19 has the ability to grab that oxygen forming heme group inside the red blood cell. I don't want to get too technical. The red blood cell, everybody knows, carries oxygen. And what's happening is the COVID-19 virus is basically disabling your red blood cell from carrying oxygen. It won't allow the oxygen to attach to it. And these people are coming with low oxygenation levels. So now you have what is the equivalent of a cascade of altitude sickness. Because you have a low oxygen. It's like climbing Mount Everest without getting ready for the climb. And that on top of the lungs being compromised, that's why they're going downhill so fast. So what I'm doing is, if we look at hydroxychloroquine, and everybody's, been kind of moving around, jockeying around and positioning whether they should take it or not, should we be on hydroxychloroquine, and what time is it indicated, etc. What does hydroxychloroquine do as a malaria drug? And that's where it's adopted from. It basically creates a protective barrier around that oxygen carrying part of your red blood cell, so the malaria doesn't eat it up. Well, the same thing happens with the virus. It blocks the virus from eating it up. So I'm not waiting for my patients to drop their oxygen levels. I happen to be treating them quickly. I'm not making any recommendations to any doctors, but I'm just sharing with you my successes in so far with my patients in Dallas. But whether you're a physician, and it goes, it's state by state, whether the medical boards are recommending hydroxychloroquine, I just wanted to add a little bit more insight into how this virus is acting. So it does hit the lungs, as everyone knows. It also infects the heart and causes a viral myocarditis or a viral infection of the heart. It's affecting the red blood cells. It's also affecting kidneys, et cetera, et cetera. So it is it's a multi-system organ attack, if you will, on the body. And that's why when somebody has a weakened immune system, if we're aged and we have multiple comorbidities, we have diseases of aging, whether it be high blood pressure, diabetes, et cetera, those people have impaired immune system. That's why they don't do well. But we know in this country, part of the problem is we have an obesity epidemic. We have people with already with blood sugar problems in their 40s, and so it's not a benign infection for any age group. It depends on how well your immune system is prepared to fight it off.
Right. With that medication, you're starting early then? You are using it. You see it as being
practically, you can. Half-life is pretty long. It's about 20. But we can't really recommend it. It's not indicated for that. It's only indicated for acute treatment. But there are some studies out of India that show that people have been using it prophylactically.
Right. Well, for me, there's a lot of, like, with the conventional media, it's like people saying, don't use it. Some are saying do use it. And it's nice to talk to clinicians who have some experience and actually can clear up some of the confusion about the med.
We've been limited to telemedicine. Yeah. Fortunately, telemedicine is in my wheelhouse. I've been practicing telemedicine for 10 years in my practice between California and Texas. You're always doing some sort of telemedicine with that type of setup, if you will.
Yeah.
And here are it used to be initially when they said the symptoms are going to be sore throat, high fever, chest pain, shortness of breath, then you're going to call your doctor and maybe go to the emergency room. What I'm seeing now is I'm not seeing fever right away. I'm seeing dry cough in my patients. And I have several patients that are airline flight attendants, And a lot of them, over 600 of them, have been infected by COVID-19.
Yeah.
Their job, unfortunately, and they have the exact same scenario: extreme fatigue, there's no fever, they're not short of breath. I've heard this 3 times. My lung tubes, my bronchioles are on fire, doc.
Yeah, my chest hurts.
Yeah.
That's when I'm not waiting.
Right.
I'm prescribing, and what I'm prescribing is I am prescribing hydroxychloroquine early, and I can't wait for a test for that test to come back positive or negative. They're not 100% effective or not 100% specific and sensitive. So I'm treating early, and they understand the risk and benefits of hydroxychloroquine. And by the way, as a rheumatologist, I've prescribed countless, prescriptions of hydroxychloroquine in my patients as a rheumatologist, and it is quite safe.
Okay.
There are some issues with some, with some irregular heartbeats, et cetera, that can be serious, but they are quite rare. But I'm not recommending anybody take it prophylactically for prevention, but I am aggressive with it early on because we weigh the risks and benefits of how healthy is this person? What are their chances of, in a short period of time, deteriorating to a point that they're going to need a critical care bed, and the medication. And we're all opting between the physician and the patient. We're opting for that for the medication. And
so it sounds like as a physician, as a clinician, you just have to make sure that these people that are taking it don't have whatever heart condition it may cause a negative side effect on, right? And for the most part, those are rare.
There's some drug interactions too.
Are there? Okay.
Right, with azithromycin, and there's some things like you want to optimize their minerals such as magnesium and potassium. Okay. So everyone should be on some magnesium, a good form glycinate, a chelated form of mag, and potassium. You get mostly from food, but if you are deficient, that will prevent what's called a QT interval. Will help prevent.
Okay.
Reduce the
Reduce the risk. And there are some peptides that we also recommend. One is Thymosin alpha-1, if you want to discuss a little bit about that, but I'm on it. We're doing everything we can. We just actually tested ourselves on immunoglobulin G and M. So there is a test now available to test for your,
if you
had exposure, or if you have any immunoglobulins, meaning that you've had it. So we were negative, but there are ways to test for that. It's a blood test.
Can you talk a little bit more about that? Because I'm not aware of that. Because is this because you hear on the media, right? You can't get tested. And if you do get a test, a lot of people are being turned away. And if they do give you one, it takes like 2 weeks to turn it around and get the result. Yeah. So what is it?
They can contact the clinic, and I can mail them a test to their house. If phlebotomists can come to their house for a certain fee, or they can go to a lab. And have just one test tube, and turnaround's about 48 hours. And this is more for patients that have had exposure, or have had it, or just feel like they've had it and want to see if they're resistant to it now.
So a patient who's like, you know what, I've been flying a lot. I know I've been around people who have had a positive test. Is that what this is
correct
for? And the name of the test is what is the name of this particular test?
The COVID-19 immune assay. Yeah, we get it from LabCorp.
So it's a blood draw. It's a serum test.
Okay. And we're just looking at, and in that test, we're looking at the status of the person's immune system?
Antibodies.
Antibody response.
Okay.
So you can tell if you have what's called an IgG, the early response of the immune system to respond to the virus. If that's positive, IgM, if that's positive, you have an acute infection. If you've converted to IgG, you have a short-term immunity against it. And those are the patients that they're checking right now in Dallas, for example. If you've convalesced, you've gone through the illness, and you've converted what's called IgG, those antibodies, they're doing plasma therapy with them now. plasma,
Wow. Okay.
plasma. And a little aside, not everybody is converting in 14 days like they thought they were. Some people are becoming chronic. So we're learning more and more about this virus and how it may not be just like a typical influenza where you have the flu and now you're good for the rest of the year because you have antibodies against that particular strain of virus. And it's turning out that we have several patients now that are becoming chronic and they're not converting. So you do not want to get this virus.
Yeah.
We may not be able to completely defend against it, but back to the premise that we need a very strong immune system, do everything we can to prevent from getting this infection.
Okay. But this is a test that anybody can run right now, right?
What's happening is there's two systems. The drive-throughs, et cetera, are more CDC driven, and those test kits are coming through government. You just drive through, there's no charge. Then there's the private sector through the labs that we work with. There are fees involved with it, but there is the blood test that Mary described. There's also a nasal swab that is what's called a PCR test that does check for the active virus in the nasal passage. That can be sent to the patient, but still that will take several days to determine if that patient does have active COVID virus. So there's one other test. It's a finger stick. It's probably the least sensitive and specific. None of these tests right now, I believe, to the best of my knowledge, are FDA cleared.
I see.
They're just getting them out as quickly as possible to the population so we can get some understanding of the percent of patients that are population that is infected, have been infected, and have convalesced.
Okay. So that's fascinating. I mean, so people can get some testing done on their own if they want to, if they're talking to, you know, okay. And they can contact you guys and possibly get that done, right?
Sure.
Yeah, or get it done through our clinic via you, Mary. Yeah, that's great. That's not something I was aware of. Were you, Brian, aware of that?
I just think the breakdown overall is fascinating. Like I didn't understand necessarily how the malaria drug interacted and then how it could be beneficial in these types of patients. So it's that breakdown in itself, it's just fascinating how I haven't heard, I've watched so much news and I haven't heard any of this or any recommendation on the back of the 15 days to stop the spread where it's like, take vitamin C or this or that.
Yeah.
It's nuts.
Yeah. So getting back to this then, this test, you can actually, there is a test out there. They're just not FDA approved. And, but that is, I guess, like people can start now with the immune boosting stuff you've already mentioned, right? Because there's no harm, correct me if I'm wrong, there's no harm really, right, in taking vitamin C, zinc, vitamin A, vitamin D, N-acetylcysteine, right? I mean, can you think of issues with that? I mean, what about with that high dose vitamin D? For short term, that's going to be fine, right?
Short term, that's fine.
Absolutely.
Okay.
What we see is if you're an existing patient, I know my vitamin D levels in my patient, and I know ones are low, and that's an easy decision.
Okay.
I know if you have an acute virus, put COVID aside, and somebody says, "Hey doc, I think I'm coming down with something," I will give them high dose. I'll recommend them high dose of vitamin D for the first 3 days, and then stepping down back to about 10 to 5,000 units. But vitamin D is very powerful. It stimulates something called a defensin, or peptides actually that are produced by our white blood cells, our neutrophils, which are antiviral. And one of the mechanisms of vitamin D in fighting off viruses is it doesn't go to our white cell, the neutrophil in particular, and have it stimulate what's called LL37. That is one of our peptides that we use as an antiviral in acute illness. Now we did have a podcast on peptides. They are a unique category of therapies that have been around for decades that are not FDA mainstream standard of care. But if you're going to have a visit, you go with an integrative or functional medicine doc, and they're trained on peptides, that's the conversation you would be having with them. These are all naturally occurring amino acids or proteins that are found in the body that are now made synthetically by compounding pharmacies and are available to physicians that practice integrative medicine.
Yeah, and that's something that I haven't heard about, using peptides to help boost immunity or to fight this particular virus. I mean, that's fascinating. So I know you guys are experts in that, but you just don't hear other clinicians talk about them. I guess it's just because, it's not part of the standard education, right? With most clinicians.
Correct.
Yeah. So, and to do this, is it oral form? Do they have to come and see you guys? Do you inject these? How does this work?
They're normally, the ones that we're recommending is injectable form only.
Okay. So they definitely need to see people like you to get them.
You can self-inject. So I train my patients how to self-inject.
It's like doing an insulin injection into the belly skin. Very small.
Right. So it's easy for people to get them, and you show them how to do it. They could do it on their own, right?
That's correct.
Oh yeah.
Okay. That's great. And you guys feel like this is very important, not only for this virus, but just your immune system in general, I would imagine.
Well, when you look at the mechanisms of one of the peptides that Mary mentioned, it's a thymosin. Again, it's a naturally occurring peptide that is made in the thymus gland. There are several of them, but thymosin alpha-1, by the way, is an FDA-approved peptide. It's called Zadaxin, and it's an orphan-approved drug. So it is on the market, recognized by the FDA for various uses. And if we put the immune boosting qualities of TA1 or thymosin alpha-1 aside, it's very effective in the use of autoimmune diseases, for example, Hashimoto thyroiditis. It calms and balances the Th1, Th2. We're getting a little technical there, but it helps that immune system not over-respond, but respond enough to help control the body to produce or not to make antibodies against itself, such as we see in Hashimoto thyroiditis. So that's a classic example, and it works very well. We look at the use of thymosin alpha-1 as a preventive or as a therapy in integrative medicine as an antiviral, and we know the mechanisms. The science is there. We know how the thymosins affect the immune system and how they improve the response to fight off viruses.
Right. And what's the downside to using something like that with what we're talking about?
Again, thymosin alpha-1 has little to no side effects, and it's been around for decades. And as a naturally occurring peptide that is in higher levels, greater levels when we're 15 versus 50, that's the reason why our immune system is so robust into our, into our teen adult years and into our 20s, because our thymus gland is huge. It's large and it's very functioning. It's making a lot of these thymosins when we're in our youth. As we go throughout the decades, those thymosins start to drop off. Our immune system becomes less and less vigilant. It has less ability to recognize a virus and respond. It has less ability to recognize the cancer cell and respond.
Right.
To help support that, immune vigilance and the robustness of the immune system, thymosins are actually quite effective.
Right, and as you're saying, very, very little downside. And based with you guys being here, there's so much that you guys have said that is just not talked about that can really give people some extra protection.
I think it's in the integrative medicine community, it's one of the most popular recommended peptides in this current dilemma and pandemic we're experiencing.
Wow. Yeah. It's
back order.
Yeah. I mean, no, it's fascinating. I'm thrilled to have you guys on to talk about this. So I, one thing that's big in the news right now, and I think you hit on it, both you and Mary hit on it, but why is there demographically, why does this seem to be hitting people of color more than others? I mean, what are your thoughts on that? Because that's been in the news quite a bit. So I've been hearing in the news, and maybe it's just, inner city versus rural areas, but what is going on? Is it just because for people of Hispanic descent or African American just have higher rates of certain diseases? What are your thoughts on that?
Yeah, I would say that they're mostly, their immunity is compromised, and they may feel okay, but they have inflammation going on. And it takes a virus like this sometimes it's like the straw that breaks the camel's back. Oh, okay, yeah, I have been, walking on this line for a long time, and now I'm exposed to it. And there are a lot of people that I know that have had exposure, and they sometimes bounce back within 4 to 5 days. But you're hearing more about those that 40-year-olds, 30-year-olds that are immunocompromised already, that their insulin resistance, they're borderline diabetic.
Right.
There's high cortisol,
lifestyle, high inflammatory diet,
right.
obesity, metabolic syndrome,
right.
pre-diabetes, the unfortunate illnesses that do go with a more impoverished, demographic in our society.
Right. Even I was hearing like stuff. A lot of these, a lot of people of color also are, living in areas where there's high pollution rates too. I mean, I don't know if that has a role in that too.
Huge role.
Yeah. Okay. Yeah.
In my opinion, we
right.
look at the perfect storm, for example, in northern Italy, which was certainly the impact of Asians or Chinese working in offices and factories in northern Italy that brought the COVID virus quickly to that part of Europe. In addition, we had Milan, which has a high pollution rate. There's a significant amount of pollution. Most of the population, it's the oldest population in the world, actually. Italian by percentage have the highest highest amount of geriatric patients or older patients, I believe, even into their 80s. I think it's over 30% of the population.
Oh, wow. Yeah.
Smokers, pollution, elderly, you're going to have a significant mortality rate.
Mm-hmm. And that's what we're seeing right across the world with this, even though and nobody's immune, but across the world, it's the elderly with certain health conditions. Yeah.
It's there are a lot of there are things that will be elucidated. We will get to the bottom. We'll get to the truth of it eventually. We don't know exactly why. Asians, for example, one of the ways the virus attaches to a human cell and gains entrance into the cell so it can replicate and then go back out and make more viruses is something called an ACE2 receptor. And the ACE2 receptor is more common, and they have more of them in an Asian population. But the Asian population actually has fared better than the Caucasian population overall when you look at the numbers.
Wow. So there's a genetic component to this then?
There's definitely a genetic component to it. We don't know all the genetic aspects or the predispositions to it, but that happens to be one of them. That's a readily known one because we knew that from the SARS virus back in 2003 or 4, whenever that hit. It's a very similar virus but still very different. Right.
So it's not just about the cultural acceptance in Asia of wearing masks then. I mean, they may have a genetic advantage.
No, they have a disadvantage.
Disadvantage, okay. Disadvantage.
The more ACE receptors you have, the more doorways for that virus to enter into the cell.
Oh, I see.
But I think you hit it on exactly on the head. They actually implemented quickly, more nimbly, the use of masks in public, shelter at home, etc., to isolate the virus and square off that curve.
Right.
Singapore did a great job. Because it's a very small population. They have a great healthcare system. For the first, I have a physician friend, colleague. She lives in Singapore, so I was getting firsthand what's happening in Singapore. Anybody that was going into the hospital they have great healthcare. Was coming out. There were no mortality, no deaths for quite a while. They controlled it, and then what happened was the second wave that was actually coming into the population were expats, not expats, but people from overseas that were not citizens. Non-citizens were coming into the country actually were firing up the numbers again, the infection rate again in Singapore, and now they're controlling that. South Korea did a great job of, I don't know if it was mandatory, but everybody in Asia, it's very common for them to politely wear a mask because you don't want to infect. It's not for them. They understand it's not to protect them. It's to protect someone else. Right. So if you put two people in a room, both of them have a surgical mask on or any protection. And there's a study done at Wake Forest that we'll share with you. We can get you the slide, that if you wear protection and you're not infecting that person next to you, and if you're both wearing it, you really reduce the transmission rate from one person to another appreciably. The CDC has just decided in the last week or so to say, hey, it's probably a good idea that everybody wears a cover over their face. They wear a mask. But we can't mandate.
And thanks to Mary and our clinic and telling us we were ahead of the curve, Mary, to everybody wear a mask, get on board with that right away. So we were telling all our patients to do that way before that happened. It just seems like common sense. And I think the conventional media really fumbled that. They should have been promoting that. I know why they were afraid people were going to hoard masks, but like you said, any protection helps, right?
Absolutely.
Yeah. I mean, the study that was just published at Wake Forest showed that if you fashion a mask with two paper towels, just household paper towels, and you were able to create a decent seal, a barrier around your mouth, you have decreased the chance of transfer of the virus by 85%.
Right.
That's the most surgical masks. And an N95 mask is called an N95 for a reason. It blocks only 95% of all infectious viruses, etc. We're down to about 3 microns, the hole that the air and the viruses can pass through, and that will capture most viruses.
Right.
So if you get 85% out of 2 paper towels,
that's fascinating.
That's pretty darn good. Yeah.
Well, the other thing is I've been wearing a mask at my clinic for since this began, and thanks to you, Mary. With your advice. But the thing I noticed is it prevents me from touching my face. I mean, plain and simple. I'm not, I have a barrier, so I'm not rubbing my nose, touching my mouth. And it's amazing to me how many times if you catch yourself doing that.
Yeah.
Humans love to.
I know.
Hundreds and hundreds of times every day.
Right. Yeah.
6 weeks ago, I sent out an email to all my patients. I said, for the next couple of months, try not to wear your contact lenses.
Yeah.
Touching, because we know now that you can inoculate the virus through the eye.
Wow.
So if you're wearing contacts, probably a good idea to leave contacts out of it for a while and wear glasses if you can.
Right.
And that's another way to stop touching your face.
Right. Do you guys have any comments on is there any correlation between the dose, the amount of exposure you have of this thing or not? Like, it just seems like, to me, I just think about, okay, if I'm in New York City and I'm walking down, walking towards the downtown area or down to Wall Street from the Central Park, it seems like anybody who coughs and the wind's blowing towards me, anybody who coughs 2 blocks away can infect me.
Right.
I think in the beginning, everybody was afraid to even say, oh, it's okay to go to a park, or if somebody's coughing in the next house over in the backyard and I'm in my backyard, am I going to get it?
Right.
And physicians that, all the experts on TV were saying, they had no idea. They said, it's probably better just to go in the house and wash up and change your clothes. Well, everybody was getting, let's say not a little paranoid, but a little hypervigilant.
Yeah.
But now we see what happened was we did the social distancing. We're talking about 6 feet from keeping a 6 foot distance from everyone in public. And now the other day, the CDC said, if you're going to go inside that 6 foot distance, for example, you're seeing a patient, limit your exposure to their breathing under 10 minutes.
Under 10 minutes.
Okay. So there is a dose thing that goes on.
Droplets. So there is a dose, and there is some science, and
yes.
the best of my understanding that I can recall is if you get a large inoculate and next to someone who sneezes on you, you're going to have a much greater chance to have a to contract the virus and have a more significant course.
Yeah, and this is why that for healthcare workers on the front lines, they're getting potential exposure every day, right? So that's why it's so important for them to, be fully protected with that. Anything else we should hit on with this?
I was just curious as to your guys' opinion as far as going forward. What type of stuff do we carry with us?
Yeah,
are we
question.
not shaking hands 3 months from now? Or, what does a concert look like? Or just in your opinion?
Yeah, culturally, where are we going next? Yeah,
we're changing. We're adapting to the changes for sure. Look at medicine. Everything is done, remotely now.
Right.
So practitioners have had to adapt to these changes. And I think for sure handshaking is going to be
out
for a little bit. Yeah.
Two good points. I think telemedicine is dug in and here to stay now. They've loosened the guidelines up in most states for us to be able to treat effectively through telemedicine a lot of these patients that we don't, and it doesn't make sense to see at the office. And that's exactly what I'm doing. It's soon you don't have to get the hang of it. You can tell right away. You don't need to put hands on that person. You can do it all through telemedicine and get them therapy as quickly as possible.
Yeah.
And I agree culturally. Some of these, the viruses that we're going to see now is the COVID-19 and future viruses are probably going to be here to stay and are much more infectious. So shaking hands may be a cultural, distant memory in the not too.
Yeah, I think it should be, right? It's good. Yeah, I think it's going to have to be, and I think that simple cultural change will, keep transmission down, like you guys are implying.
Yeah, I think it will. It does. It's already in our culture. I don't. For years in flu season, I will shake hands. In summer when we don't have a lot of transmission of viruses and colds. But I do. We went to fist bump, which by the way does transfer a little bit of virus. Oh man, I can't even fist bump people. So now people are elbowing, and feet.
Yeah.
And I think that's going to be the future.
But we got to come up with something that people can do. Maybe the old Spock, like this. Peace be with you. Like don't touch, or maybe this, or bow, or I don't know. But we have to come up. Yeah, we have to come up with something other than what we are doing. But I also think like there are other behavioral changes that seem to help, right? Like I talked about, this is prominent. Seems like in the Asian culture is taking your shoes off, like as soon as you walk in the house, right?
Absolutely.
I mean that can be helpful.
Hygiene, very important, which we don't have in the country. Mm-hmm.
Yeah, and then also being better about washing your hands.
Absolutely. Yeah, I think on a positive note, when we see the resurgence, and everybody's concerned already about the resurgence in the fall of this virus. Mm-hmm. We had one with SARS and H1N1 and bird flu, and it was a greater resurgence. It was a greater impact and greater numbers than the original, virus that when it was introduced into the population. And those were viruses that are very different animals, if you will, very different type of viruses. This particular virus is in a class by itself. It's pretty diabolical. It's very infectious. And I think between now and that next wave in the fall, everybody's concerned about, which if we don't do anything, it's going to be even greater potentially based on previous viruses and how they act. We're going to have therapies, I think, that are going to be in place and ready to go. Everybody's worried about how long this is here to stay, but how are we going to control it?
Right.
I don't think vaccines are going to be, they're going to be developing vaccines, but I'm going to be pro therapy. You treat this virus rather than to prevent it with a vaccine personally.
Right, because the vaccine is specific, and what you guys are talking about, hey, boost your immune system, is very non-specific. It's broad. It will help you against most viruses, right? Most infectious agents.
Absolutely.
Yeah, absolutely, totally. I mean, if we look at diet, as I mentioned, low inflammatory diet. There are just a whole bunch of studies just click off. We know that even shift workers that don't have, we have poor sleep or don't have consistent sleep, a much higher incidence of respiratory tract and viral infections in flu season and during the winter. Low inflammatory diets are have a much lower incidence of infection. So when we just go back to the basics with lifestyle and plant-based diet. It's low inflammatory, high in the nutrients we keep hearing about. We keep recommending. We're recommending in higher doses right now for 2 reasons. One is most people are deficient and they don't realize it. And number 2 is you need a lot more of these nutrients, because if you do contract the virus, your body's going to be in high gear trying to fight it off, and it's going to consume a lot of these micronutrients a lot faster than you can ever imagine.
Yeah.
So
fascinating. Brian, is there anything else you want to ask?
No, this is one of the great ones where I just get to become a listener. This is perfect.
Yeah, I mean, it's fascinating. Hey, Mary and Joe, do you guys want to just tell us briefly how people can get in touch with you? What's the best way, what they need to do? I'm sure a lot of people are going to be wanting to know how to get testing and, some of these treatments you talked about.
Yeah, so they can visit the website, which is boutiquewellnessncnorthcarolina.com, or they can call the clinic, through the Naturopathic Health Clinic and talk to Melissa, and they can get in touch with us that way. We are able to treat remotely, so we can send you kits anywhere, pretty much anywhere in the country that would like to be tested. So we're happy to do that. We are developing an immune booster program that includes all of this, and lifestyle management. So they can learn more about that on the website. And we're going to be able to team up and oversee their care, acutely or long-term, or whatever they would want. We also specialize in anti-aging techniques as well. So we'll be offering some super elite programs in the future. So
okay, great. That's
great. It sounds like the real benefit there is the multidisciplinary team, which was one of our first 10 episodes. We talked about how the need to have a multidisciplinary healthcare team. That sounds like you get really an exquisite team coming to help you out.
Yeah.
We have kind of 2 phases of this. So we're in the acute phase right now. Anybody that is worried about contracting this virus, we have plans to be able to boost your immune system. Then number 2, we can treat COVID acutely through telemedicine. And as we have developed our lifestyle programs, their focus is really honing in on those 4 cornerstones that we always refer to, which is classic lifestyle medicine, health coaching, healthy lifestyle, hormone balancing, et cetera, thyroid, all the things you expect out of a comprehensive program. But the focus now is these issues are not going away. So we're always going to be focusing our lifestyle programs on optimizing our immune defenses against this current virus and the future ones that are going to be coming down the pike, if you will.
Yeah, I mean, right. They are going to be coming down the pike, and we just need to be prepared for them. And thank you guys. Thank you so much for being on today. And I love this podcast because the other thing about it is at least for our listeners, I think you guys indirectly has given a lot of people hope with what you were saying. So
absolutely, thank you.
Yeah, it's wonderful. So thank you for that.
All about focusing on the immune system and all the other guidelines that have been put in place, and we'll get through this, and we'll be successful in beating it.
Well, yeah, thank you so much. Love having you guys on. It's always a
Thank you.
wonderful learning experience.